Hi everyone, I am Dr. Razia, Associate Professor of OBG Department of Shadan Medical College. Today my topic is about postpartum management in a COVID positive patient. Today we will discuss only about the how to manage a patient regarding the lactation and vaccination. So when the patient is COVID positive, when the mother is COVID positive, whether she can lactate or she cannot lactate, these are the queries on many of our people. So during the COVID positive patient, if the patient is having asymptomatic and she is home isolated, she can lactate the patient. She can lactate her baby. So there are two methods when she is at home. She can lactate her baby. Whether anybody is there or the home care worker is there to assist her, she can breast pump her milk and she can give it to the attendant to feed her baby. Other thing, when the mother wants to keep the baby with her, she can breastfeed her baby, but she has to take the precautions. So what are the precautions she has to take when she is feeding her baby? So first thing, whether it is by pump or whether it is she is keeping her baby to her breast, she has to take all these precautions. So number one is, if she is temporarily separated, that is temporarily separated from the baby is separated and somebody is taking care her, helping her to feed the baby. First thing she has to take is the attendant should be vaccinated, or it is a healthcare worker or somebody who is helping. They should be vaccinated and they should wear a mask when they are coming in, and they should be mask should be wear, hand sanitizer should be there. If they are having the facility of wearing the shield, they can wear the shield and come into the room. Then next thing is, what she has to do. The mother has to first is wash her hands, sanitize her hands, then she has to wear a mask, then put on the shield, then the breast should be cleaned. The breast should be washed or cleaned, and it should be she can take her baby and she can feed the baby. Then if she wants to, the same thing has to be done if she wants to pump the milk and feed the baby. So during her postnatal period, the mother and the baby has to be protected. So one thing, the mother, if she has to monitor her temperature, her blood pressure and her oxygen saturation. The symptoms, if she is having increase in temperature, if she is having any cough or any drop in the saturation, she should consult her healthcare worker. So the healthcare workers, if these symptoms are increased, she has to consult her doctor through the video call or through the mobile or through the telephonic call. So these are how there is increase in these symptoms, she has to be moderate or severe symptoms, she is going increasing temperature, she should be hospitalized. If the case is moderate or severe, she should be hospitalized, and ICMR guidelines protocol should be managed in the hospital. So regarding her isolation, she can be, when she want to keep her baby with her in the same room, if there are no facilities, she can room in, means she can keep her baby in the room, but there should be a physical barrier like a curtain or a cloth should be there in between her and the baby, and the baby should be kept at a distance of 6 feet from her. It should be kept at the distance of 6 feet. So all these precautions should be taken during when she is keeping her baby in the room. So next thing is regarding the vaccination. Regarding vaccination, there is a say that they should not take the vaccination that during she is lactating. According to our guidelines, she can take during lactation also, she can be vaccinated. But when she should be vaccinated, number one, she is COVID positive. Her COVID positive, that is RT-PCR, that her test should be negative. After negative, she can vaccinate 8 to 12 weeks after the test is negative. So when she is negative, 8 to 12 weeks after that, the period after the RT-PCR, she can get vaccinated. So regarding the vaccination and the symptoms, so if she is severe or if she is going into temperature increasing or anything, she has to consult her doctor. The healthcare workers who are there with her, they have to encourage the patient, the COVID patient, regarding the breastfeeding. The virus is not transmitted via, there are no studies that the virus is transmitted through the breast milk. So the healthcare workers should encourage the mother to feed her baby and counsel her that the virus is not transmitted through the breast milk. So the healthcare workers should give the tell the COVID, encourage her that she can breastfeed her without any problem. And during the postnatal period, the mother should take all her vitamins like iron, calcium, and vitamins should be taken. Asymptomatic cases can be isolated and they can be treated at home. So these are the precautions taken during her postnatal period. If she has any complications like bleeding or anything severe postnatal or breast engorgement, she should consult her doctor through her healthcare worker. So stay safe and have a healthy and maintain your hygiene. So this is the thing we are going to say during the COVID period. Thank you very much.